So now for our next discussion, we'll be talking about causes of conjugated hyperbilirubinemia. Now before we talk about the causes, I would just like to give you guys a brief story of what conjugated hyperbilirubinemia is. So when bilirubin is formed from heme, it comes into the liver. So when it comes into the liver, that's when it is mixed up with what? Glucuronic acid. So it is the bilirubin that is mixed up with glucuronic acid. That is the bilirubin we say it is conjugated. So what could make conjugated bilirubin level in the body to go so high up? Okay, so most of the times after obstruction, after the same conjugation, it has to be excreted into the gut. So what could stop bilirubin from moving into the gut? Of course, obstruction. So there could be blockage of bile flow outside the liver, things like biliary atresia, Choledochal cyst, tumor growths, Gallstones. So Gallstones could block the pathway for for bilirubin to actually what? Flow to the gut. Bile-duct strictures, having some tightenings and all of that, right? And some tumors that can compress the bile ducts, like the pancreatic tumors, cholangiocarcinomas in adults. Then sometimes it could be what? Intrahepatic cholestasis. So this is defects in bile formation and also what? Secretion within the liver. So hepatitis can also cause it. Then there's a genetic issues like what? Alagille syndrome, progressive familial intrahepatic cholestasis. These ones are very rare, Alpha-1 antitrypsin deficiency, galactosemia, tyrosinemia, right? Drug-induced cholestasis, pregnancy-related cholestasis, and the rest of it. It could be infections, toxoplasmosis, syphilis, rubella, herpes, okay? Then it could be bacterial, okay? Then also it could be viral infections, all right? So that's what we got for the classification.